Good afternoon, everyone. My name is Sarah Coleman, and I am the Senior Director of Race and Gender Equity here at YWCA South Florida. And I'd like to welcome all of you to our speaker series. This is a series where we have a discussion, a lively interview with someone who is moving the needle, someone who's doing work that pushes women towards equity. And so we are really lucky today to be joined by Dr. Rose Martin, the director of Miami-Dade County Commission for Women. If you know her, you know she's a bit of a legend. She is just, she's a force to be reckoned with. So Rose, thank you so much for joining us today. And the reason we have invited Rose to join us today is because that Rose, along with the Miami-Dade County Commission for Women, are fresh off the release of their 2024 Status of Women report. This report is in its 8th year. And for those who are doing the work around equity for women, whether it's healthcare, human trafficking, the wage gap, this report touches all of that. And so we are so excited to talk with her today about that report, about the findings of that report, and how we can use it to create a more equitable Miami-Dade. So for those of you who are joining us, welcome. Keep entering your names in the chat. We will have a lively discussion with Rose, and towards the end, we will take questions from the chat. So pop them in there and we will get to them. All right, cool beans. Rose, welcome and thank you for joining us.
Thank you. I want to thank you, Sarah and Lauren, for always creating like this space for dialogue. You know, the YWCA South Florida, you guys are such incredible partners. You show up to our board meetings, you offer your location for our board meetings, and we are incredibly grateful because I know that when women in particular get together and have dialogue and kind of have shared space, a lot of incredible things happen. And even though this isn't a topic, I feel sometimes like when I say, I'm going to talk about data, let's have a meeting to like go over a report. Most people probably run and hide from that because it doesn't sound very fun, right? And it sounds like educational or mechanical. But data is important. It's really important. It tells us a lot. And it is what I love about data is that it is not subjective. It is concrete. It is objective. And in today's world, in particular, in today's political climate, where things can be polarizing, where certain terminology can be divisive and it is politicized, having data talking about numbers is safe. It's safe and it's grounded in reality and it's grounded in fact and it's beyond ideology. So I think now in particular, the usage of data, the usage of like reports such as the Status of Women report is more critical than ever. So kudos to you for having this space, and I'm really excited to be here.
I mean, yeah, I couldn't have said any of that better. I feel like right now we need to connect behind the things we all can support, and behind this data are human beings. And so I think you nailed it. Yeah, like everyone can get behind numbers because they are factual. They're telling a story with facts. So we're gonna jump in. And I promise this will be exciting. It's a very interesting report. But we're going to start at its beginning. So this report was born from CEDAW. And for those who don't know what CEDAW is, what that acronym stands for, can you talk a little bit about how this report came to be?
Yeah. So if you don't mind, I want to talk about CEDAW, and then I kind of want to introduce the Miami-Dade County Commission for Women as a government advisory board and kind of how we work together. So CEDAW stands for the Convention on the elimination of all forms of discrimination against women. It's a landmark United Nations treaty, I think from 1979. And it's really known around the world as like the International Bill of Rights for Women. So when this treaty happened, which we call CEDAW, because as you know, the Convention on, on the elimination of all forms of discrimination against women is a very long
Yeah.
term. The US signed it, but they did not ratify it. And so, in response to that, a bunch of cities came together and they said, hey, like, the US didn't ratify it, but why don't we implement this in our communities? And and they started this movement called Cities for CEDAW. And Miami-Dade County, and this started like I think in like 2014, 2015, and Miami-Dade County was the first one to say, hey, we'll adopt this, we'll turn it into an ordinance. And through the sponsorship of our now county mayor, Daniela Levine Cava, who was our commissioner at the time for District 8, she sponsored it and it became an ordinance. And essentially, Miami-Dade County adopted the CEDAW, adopted this treaty. And what that means is that every year there is a report called the Status of Women Report. And it focuses on 3 areas: education, economics, and health and safety of women living in Miami-Dade County. And the idea is that we take this data, we look at education, economics, health and safety, and we use this data to then create policy, to track changes, to develop legislations that's directly meant to improve the lives of women and girls. And the Miami-Dade County Commission for Women in particular is a government advisory board. And we take this data and we essentially advise the Board of County Commissioners, our county mayor, and the community at large on this data. And then we make recommendations for policy, and then we track it using this data.
Thank you. I think that gives such good context for this report. That was so helpful and thorough. It makes me excited to keep going. And I feel proud of Miami for bringing in this CEDAW and becoming one of those cities. I did not know that, but I feel like a lot of things go wrong in Miami, but this went really, really right. So that was really awesome to hear. So this is the 8th Status of Women report. This is a big question, but how are the women of Miami-Dade doing?
Right. That is a big question. And
That's huge.
A question of that magnitude, as you can probably surmise, the answer is incredibly complex.
Yes.
So we've seen real progress in some areas, like there's rising educational attainment over and over again, like women are more educated, there's higher college and high school completion rates. We've also seen that women have stepped into more leadership roles, in particular in the county. And in a moment, I mean, if the opportunity allows or people are interested, we can talk a little bit about some of the specific things that the county is doing in terms of even tracking metrics, like looking at how many women serve on advisory boards, or how many contracts are from the county are given to women-owned businesses and prioritizing that. Also looking into how the county pays its employees and making sure that they're collecting data in terms of, advancement, education level, and how that, women are paid in comparison to their male counterparts. But there are still some serious disparities. Black maternal mortality rates have increased sharply, and they continue to increase. Despite women being more educated, there's still gender wage gaps that exist. They're closing a little bit, but it's still there. There's still inequity. And then we do, sadly, violence against women is on the rise. And even in particular, rape cases, we like have spiked up by like almost 80% from 2023 to 2024. So while
Wow.
there's progress to recognize and kind of celebrate, these reports make it clear that there's still urgent work ahead of us.
Yeah, yeah, that's interesting. I did see that part in the report about the maternal health rate and, I think it said like of 1,000 delivery hospitalizations, 776 had, delivery issues. And I just thought that number was shocking. So there is a lot in this report. And I think, even me, which I'm kind of used to looking at reports and data, but it can be overwhelming. And so you mentioned earlier about how the Commission for Women uses this report to impact policy and to advocate for certain things. How does the commission utilize this report when there are so many things? There's so many different elements to it. How do you all go about utilizing it and advocating for those things that need
Yeah.
improvement?
Yeah. So we actually do. Again, it's a little bit of a layered question. And there's many different things that we do. So the first one is, yes, we take the data from the report, but we also we take the data and we combine it with the narratives and the stories that we're hearing. So we do reach out to the community. We have public meetings every month. Um, these are because it is a government board, so everybody on the board is appointed by their county commissioner. These meetings are they have to be open and accessible to the public, and they are sunshined, meaning 24 to 48 hours in advance. You are aware of its location, the time,
Yeah.
there's meeting minutes, there's an agenda, and there's always an opportunity for the public to speak. So we take this report, we take the data, but we also engage the stakeholders and we invite them to our meetings and we have conversations with them. And then using the data and the stakeholders, getting a real pulse for what's happening in Miami-Dade County. I know that I'm always out there, and anybody listening who is engaged in this work, has an organization, please, I will leave you my cell phone number, my email address, and I would love to come out and hear about the work that your organization is doing. The more that we know, the more that we can build capacity and collaborate together, the more of a chance that we have to really address these issues on a systemic level. And it's so layered. So part of even what I'm doing, I'm in the Office of Community Advocacy for the county, is I am out there and I am meeting with people and I'm engaging stakeholders and we're looking again at those three areas. We're looking at education, we're looking at health, safety and health, and we're looking at economics. And so based on that, the Commission for Women takes the data, the information that we get from these key stakeholders and these agencies and these leaders, um, and they make a list of recommendations. And I'm happy to share that with you. I know that we just, in September of 2020, so this is where it gets a little complicated. So September of 2024, the Commission for Women created the list of recommendations, and then they're presenting those recommendations April 8th at the Housing Committee meeting. So they're presenting those recommendations to the Board of County Commissioners. Then they have a year to track implementation of those recommendations. And I'll give you an example of like
Yeah.
of some of them. I'm looking now at one of them was like the expansion of like CVAC centers. I don't know if you guys are
Yeah.
familiar with one. So one of those recommendations we made is to have more of those centers to treat women in different areas, and we were able to open one in the South last year. So we
Yeah.
want to continue that. The other one
Could
is
you
for
briefly explain CVAC for those who are listening if they're not sure what that is?
Yeah, yeah, absolutely. And I actually had a paper because I wanted to share. There's so much data.
I
Sarah,
know, Rose, I know.
Data. I
It's
have like,
extensive.
if everyone can see, I have like 70
Rose
pages.
has, yeah, Rose has a report on the report.
I do. Oh my gosh. Hi, Shaniqua from BS. Sorry, I see a friend. I see a friend. Where is it? Because I wanted to share about oh my God, where is it? Oh
If you can't find it, it's
I
okay.
cannot
No
find it.
worries. That's
But
okay.
when we go through the data, I do want Um, so I mean, well, CVAC stands for Coordinated Victims Assistance
Right.
Center. And we, one of them, like we know that a lot of services in Miami-Dade County are concentrated in the north.
Mhm.
So we want to expand those centers so that there's greater accessibility. And I know, again, that's one of the things that the Commission for Women is working on, is getting more of these centers, especially in hubs where we see that the data is concentrated, where there's violence against women. And that is one of them. I'm very happy to share the recommendations themselves get a little bit complex, but the
Yeah.
important part is this. Now that we have our recommendations and we have the new data that's reported on 2024, we are working now to create recommendations for the 2024 data. So this is
Right.
kind of where having key stakeholders and
Mhm.
me being able to, you attending the meetings and me being
Yeah.
able, the Commission for Women, to go out there to hear so that there's real community buy-in and input.
Awesome. Yeah. I think, you talked a lot about how the commission uses this report, and are those recommendations made public?
Yes, yes.
Awesome. Yeah. Towards the end of this, I think we want to make sure everyone knows how to see this report, how to see recommendations, how to see those public meetings that you were talking about.
Yeah.
I
So I
think one
will
thing,
tell
oh,
you, it's literally on, like, it's on Miami-Dade's government website. So if you go to www.miamidade.gov/Commission for Women, there's a list of all the policies, all of the meeting dates, even the board members who are, I mentioned, are appointed government officials. That you can talk to them anytime that you want. You can invite them out to your community. You can come to the meetings, but the status reports every year starting from 2016 is directly accessible on that.
I'm actually going to put the current status report into the chat. I hope this works. I think it will. And then Taylor just put in the website for the county commission for women. So if you want to go on and check that out, I go on it frequently to see what they're up to. It is a really good way to get involved. And I think that is sort of my next kind of segue here is this is a lot of data. It's a lot of numbers, a lot of figures, a lot of charts. But what does it look like in action? And I think, for organizations like YWCA South Florida, we take this data, we take, last year's data, and we use it to develop our equity responses. So how can organizations in the community, whether they're women serving, whether they're equity, organizations, how can they use this data?
Absolutely. So the first thing I would say is, and this is kind of what I tell my the advisory board that I direct, the Commission for Women. The first thing that we want to do is, when you look at the data, pay attention to like the zip codes and the location. So if it's something in particular, for instance, Black maternal mortality rates, it's there are certain hubs where we see that those numbers are really high, and there are certain zip codes and areas of the county, because the county is 13 districts, where those numbers are really affected. Engage your county commissioner of that district. Come to a Miami Commission for Women meeting. target literally the two Commission for Women board members that represent that district where we see that those numbers align, and
Yeah.
have them advocate. Tell them about your organizations. Tell them about the needs that you are addressing. And also, we're an advisory board. So we really don't necessarily, we're not a direct service provider. Our goal is to really support the work that is being done and to make sure that if there is strategic work that needs to be done smarter or better, that we take that information and that we give it to the Board of County Commissioners, to our mayor, and then we report that to the community at large. So really, I think more than anything, it is joining forces and educating us so that we are effectively advocating for what your needs are, right? And I
Yep.
mean, and we are all ears. Like we really are. Like that's the goal, is that you are the key stakeholders. You are the one that is out there in the community. You know what is best for your community. You are engaging all the time with the people being affected, right? We're looking at numbers. You have the real story. You are
Right.
interacting directly with the people. So help us kind of put those two together. Help us join those two forces so that we don't just look at numbers, but we see beyond the numbers to the people and the lives that can be impacted.
Love that. Yeah. I mean, yeah, I couldn't have said that better. That was great. Melissa Bennett loves it too. She was clapping.
Alyssa.
So I want to bring light to the fact that it is Equal Pay Day. March 25th, Equal Pay Day. And if you aren't sure what Equal Pay Day, it is sort of a symbolic day dedicated to raising awareness of the gender pay gap. And so in the US, that date today symbolizes how far into the year a woman has to work to reach the same amount of earnings that a man has earned into the previous year. I'm sorry, into the entire previous year. So we are almost 4 months into the year. And that is how long a woman has to work in order to catch up to the men. And Miami-Dade County is no different. I think one of the more striking sections of the report is on the pay gap between women and men. And I thought maybe we could explore that a little bit. It covers 5 major employment industries where the gap could be as low as 15% and as high as 46%. I'm not sure what the past 7 years of reports have shown, but do you see any signs in these reports that point to this issue ever getting better? Like, it feels like one of those issues that just never goes away. And we move the needle and then we go back and then we go forward and back.
Yeah. Yeah. It's so strange, to be honest with you, because even as women, and you touched on this a little bit, Sarah, but even as women earn advanced degrees, even as women take on more leadership roles, the pay gap continues. And in particular, for women of color, by the way, which it's astonishing. So the data shows that there's a disparity that cannot be explained by education, because women are more educated, and it cannot be explained by experience alone. So we're dealing with some structural issues on how pay is determined. And it's layered and it seems to be nuanced, and there is no easy way to address it other than there's growing awareness and there's growing political will to act and do something about it, because as you guys are doing, you're creating spaces that are saying, hey, the numbers are not changing by much. It's very marginally. And even when we look at, is it education? No. Is it experience? No. Like all of these things, there still tends to be a persistent gap. So I know, and I mentioned this earlier, that like Miami-Dade County as an employer, like as a county government, because there's only certain things like we can't force, or we can't like we can make recommendations, but we can't force private employers to like pay women differently or like
Yeah.
to do certain things. But Miami-Dade County is committed to wage audits and to pay transparency. And we do know that wage audits allow people to kind of look into the numbers a little bit to see
Mhm.
if there's some measure of like accountability and like, hey, what is this metric telling us? Like,
Yeah.
what are we noticing? And then having pay transparency really matters. Knowing what like you could look up any, by the way, you can look up my salary online.
Yeah.
Like you can
Yeah.
look up any county, look it up so you'll feel bad for me, but just kidding. No, but seriously, you can look it up online. You can look up
Gross.
the mayor makes, and that stuff matters because then when you know when you're going you're going to the bargaining field for employment and
Right.
you know that I'm gonna make up a name. Diego makes $30,000 more than you because you looked it up online before you got to that interview. You
Right.
have some bargaining chips to say, wait, but I have a higher education, I have more experience. Why is Diego getting paid this? And then you can
Right.
ask questions um, and kind of raise awareness. And I do want to share some of the things that Miami-Dade County has done in terms of that. So one is they are tracking and reporting the number and value of county contracts awarded to women-owned businesses.
Yeah.
So in 2023, it was 9.6% of county contracts were awarded to women-owned businesses. In 2024, it is now 32%, over 32%.
Wow.
Also by monitoring median annual salaries of county employees, they are able, like, so it decreased county employees now we're talking about, it decreased from, it was 16.7% in 2023 to now 14% in
Mhm.
2024. Also employment and representation. So there is data that's also tracking women leadership in county government, women leadership in county boards. And just by tracking that and kind of making more of a concerted effort, we've also seen a raise in that. And then there's a detailed analysis conducted every year of county employees' salaries, and they're looking at educational attainment, tenure, and supervisory levels so that they
Yeah.
can try to identify and address gender disparities. So there's things on the county level that we're trying to implement, but really just awareness because this really is a complex issue, honestly, and there
Yeah.
doesn't seem to be a direct answer for it.
I'm really glad you're sharing all the things that the county is doing because I think if you weren't aware, you would just be like, what is anybody doing? Like we have this problem. Like we're working, but I didn't know they did wage audits. I didn't know they had all these things that they were implementing. So it's so
And
good
even
to
the
hear
status
those
of
things.
women report, right?
Yes.
So
Yeah.
this is all a result of the status of women report and the
Yeah.
recommendations. So those are just examples of like recommendations. Like we said, well, why don't we try to award more contracts? Since the county is awarding contracts, can we look at how many are given to women-owned businesses?
Right. I love it. I love that work. I'm curious. Um, I'm curious how, and we talked about this a little bit earlier. The age range of the people surveyed, the women surveyed on this report is young. And I'm curious how you think our younger audience, our younger members of the county can get involved in this sort of report and this data. I think it can be overwhelming for youth. And maybe seeing a report like this might kind of scare them away. But I'm wondering how they can use this report to sort of advocate or empower themselves to participate in their county.
Yeah. Yeah. No, I totally understand that. And honestly, I think that's also like kind of challenging, right? Because even I look at like the age of women that are serving on our boards. And you have to have, these are the advisory board roles. These are appointed women, but they have daytime jobs. So you do have to have a certain level of flexibility. You have to have transportation to attend these meetings. You have to have maybe income to like pay for childcare so you can go to these county board meetings. So I know one of the ways that we are addressing it as a Commission for Women is we are having more on the road meetings, meaning that instead of expecting the public to come to us, we will be out there going to the public, going to different locations throughout Miami-Dade County. And one of the cool things that we're doing, actually, that you just reminded me of, Sarah, by asking that question is our April, I think it's April 26th. So our next meeting, we have a meeting once a month. We're actually having it at Cutler Ridge Elementary, and we are inviting a local Girl Scout troop to join us. So through mentorship, by having like for this local Girl Scout group, and we're even telling other groups that want to come out, young girls, come to our meetings, sit with us, like
Love that.
having them be exposed to this dialogue and this information as early as possible
Yeah.
normalizes it a little bit, you know?
Yeah.
I know that I bring my daughter to meetings with me. So it's not like for her having conversations about women's pay and women's rights, it's very normal to her because she's exposed to it. So I do think that um maybe as the older folk that we need to be kind of conscious about bringing people
Yeah.
with us, about mentorship, about creating opportunity for the younger generation to be in these spaces and to be engaged in a dialogue, because they might not have the time, the energy, the resources, or the capacity to do it on their own. So really the onus is on us to include them in these conversations and to make space for them to be present so that they can be aware, and then we normalize it for them.
I love that. I love everything you just said. I am here for it. I have a daughter myself, so
How old
I
is your
want,
daughter?
she's 4. And last night we talked about what feminist meant. And it's just like their tiny brains, like getting them used to these words like wage gap and like all those things. You're right. Like that, I think that's how we bring them along. And I I love that, I love that you just shared how younger people can get involved. And I just think it's so important because if you're like me and you don't know this report exists until like a year ago, it's like you feel like you're starting behind the start, like way back, and you have to catch up. But if you're starting young, if you're starting as a little one, and getting involved in this work, it only has good things for the future,
You know what it reminds me of? I was when my kids, so I used to teach parenting classes. That was like
Mhm.
and I remember I would tell parents, um, let your kids say no to you. Like that's okay for them to enforce boundaries. And if they don't want to hug or they don't want to kiss, teach them that it's okay to say no now, because if you take away their ability to say no now, then when they are a teenager or they are an adult and they want to say no, they will be disempowered because they learned from a young age that no has no power. So in many ways, whatever skill you want, if you want them to be involved, if you want
Yeah,
them to be advocates, if you want them to know that they have a voice, that their government listens to them, that they can enact change, don't just expect that
yeah,
they're going to wake up one day at 18 or 19 or 20 and say, I got it. No, it
yeah,
really does start by you creating the space for them, by you giving them the language, by you including them in the dialogue. And then that normalizes things. And then when it's their turn to show up or be present or to have a voice, they already have that language. They've already been
absolutely.
empowered to do so. So really, the onus is on us to make sure
Love it.
that we are bringing them with us to these spaces because they won't show up on their own.
No, I think you're 100% right. You don't just walk into a community center and say, I'm here to advocate. You know,
Yeah.
it
And then
really,
they
it
say, where
really
are the
does.
youth? Where are the youth? And I'm like, why would the youth? Did you pick them up? Did
Did
you
you
bring
do-
the
yeah.
youth? Bring the youth with you. Like,
I
why
love
would
it.
they just show up?
Yeah. Oh my gosh. Well, I love that this went from like reports and data to like, you know, raising the next generation, raising the next
Ah.
wave. I love it.
But you have to, a lot
Um,
of organizations die because they don't. They forget mentorship. And I've seen it a lot.
so I want to kind of open it up to everyone who is joining us today and see if they have any questions. I'm wondering if any of you have had a chance to look at the report. If you want to put your question in the chat, or if you want to come off your mic and ask the question out loud, that's fine too. But we'll give some time for questions. Is anyone brave? Is anybody out there? Questions?
So I didn't see the report, so I'm not sure, as far as a point of reference of what I would be addressing exactly. So I kind of don't want to be off topic, but
Well, go for it. It
just
might
kind
be.
of
Do you want me to go through each of the three areas really briefly?
sure.
And
Mm-hmm.
what
Yeah, that
Okay,
would be great, Rose.
so I mentioned that there's education, economics, and then like health and safety. So I'll just tell you. So education, the improvements, I mentioned female high school graduation rates surpassed their male counterparts, and then female dropout rates improved. Um, Concern is, again, a substantial earning disparity persists for women with graduate degrees, showing a 35% pay gap despite higher educational attainment levels. And the implication for that is higher education does not guarantee economic parity, honestly. And then for the economics, median earnings for women increased significantly. And I won't bore you with the numbers. You can look at that later, but there was a reduction in the gender pay gap that I mentioned. And the poverty rate among women also slightly decreased, only by, 0.3%. But progress is progress
Take it.
nonetheless, and we know we got to do more. And we do see, by the way, that there is still substantial pay disparities in three critical sectors. So in finance and insurance, there's a huge pay disparity. In public administration, huge pay disparity. And then healthcare and social assistance, there's a huge pay disparity. And women continue to have a notably lower labor force participation rate. And then health, women's health insurance coverage increased. Mortality rates from heart disease decreased. And cancer mortality rates also declined. And I'm looking from 2023 to 2024, which might reflect improved healthcare access and outcomes. And then there is a concern is there is severe maternal morbidity rose. And the prevalence of disability among women also increased slightly. And then for safety and security, domestic violence incidents decreased slightly from, like, for instance, 7,618 cases to 7,551. And the reports of human trafficking also reduced slightly. But the concern that I mentioned earlier is that sexual violence offenses increased. And for me, this is a big, like, from 294 cases to 331. And then, so yeah, so those were kind of like in safety and health, and education. Those are just some of the things that might have implications for the way that we are, like, have implications for health, for safety and things like that.
I mean, it just makes me as I look at all that data, it makes me wonder how they're all connected. Like what happened to increase health insurance for women? Like what went on that there were, almost a 12% rate increase in sex offenses, like
Yeah.
especially in this climate that we're in right now, it's how will all of this impact next year's or this year's data? And so I'm very interested to see what happens.
And data doesn't provide necessarily answers. It just helps us create the questions, right? So that's really what it's doing, is it's like it raises the alert. It gets us asking, are we asking the right questions? What
Right.
should we be asking? Are we engaging the right people? Like, what's the strategy for this?
Yeah, and I think your point about, look at the zip codes, look where this is happening, see what communities these things are happening in, and, develop our response, our equity responses around that, because behind the numbers are people. And so I'm just really grateful to you, Rose, for sharing so much about this report. It's an annual report, so we look forward to it every year, but I think bringing awareness to the report and how it's used in this county and how our communities can use this report is so important. So I'm really appreciative. Anybody else have any questions? If you want to put them in the chat or come off mute, we are happy to have them. And if not, then we will wrap it up. Anyone else?
Well, I
So I
don't
have
have,
a quick comment. Okay, go ahead.
sorry, I
Jennifer,
don't,
and then we'll switch to you.
I don't have a question. I just want to say thank you. So I'm a Miami native, born and raised, moved away to North Florida, South Georgia for close to 15 years. So I just relocated back to Miami. So really just trying to relearn the Miami demographic because a lot has changed. But I will say I'm grateful for this platform. I currently work for North Florida, South Georgia VA, where I do work with a lot of veteran women. And I see that last week, actually, the Miami for Commission, Miami-Dade County for Commission Women actually did something for veteran women. And I think it's important that we are talking about homelessness and veteran women because, first of all, trying to identify, there's a lot of veteran women that are in the community that are not identifying as veterans. And because of that, there are resources that could be available to women in the community, especially in Miami-Dade. Just looking at the data and the resources, that there are resources available, but definitely see how I can play a part in providing information and just creating a safe platform for our veteran women that are in the community. And there are a lot of veteran women that are in Miami-Dade County, and I'm just grateful to see that Miami is actually advocating for women, again, moving away and coming back to see the growth and the resources that's provided for women. I just think it's phenomenal. I'm just glad to just jump on this call. I'm actually on lunch break now, and I've been on LinkedIn just trying to connect with different resources, and I'm just grateful that this platform is available to people like myself that just really want to make a difference, especially growing up in Miami and to see the growth that has happened. So thank you for this platform. That's all I just wanted to say.
Thank you. And Jennifer, I have to tell you, first of all, thank you for that feedback. And I'm so excited to hear that you attended our Honoring Women Veterans
Yeah.
event for Women's History Month. But you sharing that story is a perfect example of what I'm talking about when I say that we need you guys. Your partnership and your support is crucial to the work that needs to be done. And I'll give you an example of that. So women, you guys know, as director for the Miami-Dade County Commission for Women, which is the county advisory board for women, February, I start getting knocks on my door saying, Rose, what are we doing for Women's History Month? What's going on for Women's History Month? And I'm thinking, let's highlight an organization. Like, instead of talking about, which I love Julia Tuttle, by the way, I love history, it's my number one love. But instead of talking about Julia Tuttle for the 15,000th time in
Julia
Miami
gets a lot of
County.
love.
That's the only woman who makes
I know.
history. Let's like tap into an organization and let's highlight them. And there was, I don't know if you guys remember, but I think it was like the secretary for the Department of Defense or something made a comment about how women don't belong in combat.
Mhm.
And for me personally, I like subtle acts of resistance. So I said, oh, women belong in combat. And guess what, Boo? They've been in combat for a very long time. So I reached out to, because I don't know women veterans, right?
Mhm.
But I know organizations that work with women veterans that are already doing the incredible work. So I reached out to Julie Robinson from the South Dade Women's Veterans Alliance. And I said, hey, let's organize an event. Let's honor history makers in Miami-Dade County, our women veterans who, without their sacrifice and their, diligence for their country, we might not even have a history to defend or talk about in Miami-Dade County or the US. So she went out and she gave me the names of these veterans and we had an event for them. And that's exactly what I say when like we need you guys. Like, how can we support you? What is the work that you're doing? I put my email address. Please email me. I'll come to your house. I'll come to the park. I'll come to your location, wherever you are in Miami-Dade County within reason. I will be there because how can we support you, right? Like that's really the goal. So thank you for sharing that, by the way,
Yeah.
Jennifer. I really appreciate that feedback.
For your service, and thank you for acknowledging the veteran. I'm not a veteran myself, but I work with veteran women, and to be able to provide that platform for them, because June 12th is actually Veteran Women's Day, by the way. And so it's just important that these women, especially within the homeless population, get the resources that they need.
Mhm. Let's be in contact, Jennifer, please.
Yeah. Thank you, Jennifer. Melissa, was it you that wanted to come on, or was it Melina? I
Yeah,
think it was
so
Melissa.
it was important that I at least hear the data first, again, just so I make sure that I'm aligned to the initiative. So you made a comment earlier about the disparities with mortality as it comes to like, Black women and giving birth. I actually had a really rough experience myself. I gave birth 2 months ago and it was my first birth, and I got a chance, unfortunately, to see and understand. It's kind of emotional because it's like I feel like a lot of people don't understand the day-to-day life of what it means to be Black in America, especially as a woman. I got a chance to, unfortunately, to see the neglect, the nonchalant, the disregard in such a vulnerable and special experience. I got a chance to see it. But luckily, everything went okay. But I see why. I understand why the mortality rate is higher for us. So I want to know, is there any initiatives or any groups or organizations as it pertains to Black women? And it's not just mortality rate in giving birth, it's every area. It's literally everything. And I know sometimes people probably get tired of hearing about it because, it's like the elephant in the room, again, living in America because of how the country was structured. But this is real life for so many of us. And I'm connected to Southern
The
Birth Justice. Thank
Network,
you.
yeah.
Yeah. So I just want to see, besides that too, just any initiative, any just any awareness, anything that's out there to, that I can be a part of.
Yeah. So
Rose, if you want
thank
to, and
you.
then
Yeah. So first of all, thank you for sharing your story, Melissa. Congratulations on the birth of your child.
Thank you.
Being a new mom, I know that's extra special. But I'm sorry about the circumstances surrounding it. And I think that if anything, and this is why not to over romanticize data because it's not romantic, but that is why sometimes data matters, because what it tells us, Melissa, is that you are not alone. It tells us that the experience that you had, like, it's not just your personal opinion. the data says over and over again that women that look like you, that are mothers in Miami-Dade County, are really being affected, and they are subjected to major health crises. And we don't have the answers for it. And I will tell you, every year, Dr. Maria Elcheva, which is the researcher that does the report for us with the FIU's Metropolitan Center, I always say, Maria, why? But why? And she says, we don't know, but we know that it's real. We know
Systematic racism is a part of it.
Yeah, for sure. I wouldn't be surprised if it is not.
It's obvious. Yeah.
Yeah. And I will say, but how do we address that? And I know it's layered, and I know that Sarah mentioned the Southern
Birth justice, yeah. I'm
Justice
connected with them. They actually help me, but it only goes to a certain level. And that's the thing. A lot of these organizations, they're very limited, you know? I came to the point to where I had to go to the hospital. You know, and it always comes to that. And that's the whole thing. There is organizations, but it's always a limit. It's always when it gets down to the, when it gets down to the wire, they can help, but it's just limited.
Yeah.
The resources, it's just
true.
limited. So
it's true. And you know what? You bring up another very important point, and I saw this. So I know Shaniqua Edwards is on the Zoom, and I know her from Behavioral Science Research Institute, where I've worked as a consultant with them many years and doing the research. And one of the reasons why I was excited about this new role with the county is because, in my mind, there's research, and then there's people that are on the ground that take the research, and there's action, right? So they do like YWCA, right? They implement programs. But like what you said, Melissa, there's a limit. There's always a limit. So the idea is that it has to go beyond action. There's only so much Sarah Coleman's and Lauren's in the world. There's only so much the YWCA South Florida can do. There needs to be policy. There needs to be legislation. And I think that by putting all the pressure on the organizations to do the work, the people on the ground, knowing that there is a limit to that capacity, that it goes beyond what actions can be done at the grassroots level. There needs to be change at the government level. And I think that is why partnerships with like this government advisory board and saying, hey, like, this is my experience. These are the organizations. These are the ideas. Can you take those ideas, and how can we turn that into policy? How can we turn that into legislation, to ordinances, to resolutions in Miami-Dade County? And I will tell you, you asked also about like what happens, right? Now that we know, I'll give you an example. And this doesn't solve anything for sure. And there's a lot of work to be done. But one of the things, and I'm going to send you the report, Melissa. So if you can email me so I can send you the recommendations, because it uses better terminology than I have at the moment. But one of the things is having the county invest fiscally in resources and education to address the issue, to address maternal mortality rates, allocating county dollars and funding, whether it's having resource fairs, partnering with agencies that are already doing the work, but that are limited in capacity, location, and finances to propel the work forward. But meeting with healthcare providers, having a roundtable or a summit where we're bringing everybody to the table and saying, how do we address this systemically? What's this organization doing? What's that organization doing? Where are the gaps? You tell us. And then, so that's part of it, is like, okay, let's talk about funding dollars. Let's talk about resources. Let's talk about education. Let's create a space for these organizations that are working in this area to address the issue, and how can we support that? So thank you for that question. I love it.
I think you're right on
Thank
target
you.
there. I think you're right on target there, Rose. If you guys can hear me, it's Shaniqua Edwards. Hi, Rose. Great presentation. I'm in the car driving, so I was like trying to come off mute, but I wanted to make sure I was safe. But I think you're right on target with the policy recommendations. I currently work on and lead a project with FIU, the Black Mothers Care Plan, in which they're actually using the data based off of infant mortality rates for Black women in Miami-Dade, and they are administering workshops to providers to really push the birth equity and anti-racism. I don't want to call it rhetoric, but like a workshop for providers to kind of learn how to, and even students, it's really aimed at students who are starting their medical careers off, to know how to speak with a Black patient, to know how to not mistreat a Black mother, that and not to minimize pain. It goes through all of those proponents. But I think definitely for Miami-Dade, which was one of the interesting facts that Rose did point out, was that insurance rates for women went up, but the infant mortality rates were still the same. So to me, that speaks to, and knowing that I'm involved in that research, that speaks to there needs to be a policy in place even for insurance that gives, because research shows that midwives and doulas, Black women perform better during the perinatal period, as well as the birth. I lost my train of thought there. But the birth rates are better when they have a Black doula or midwife in the room with them during that perinatal care, that's able to provide that care with them along with the doctor. So that is an area of policy that definitely needs to be investigated. But like Rose said, it's about policy at this point, because there's no way that the numbers show that there's an increase in insurance rates for women. However, the birth and infant mortality rates are still the same.
Wow, I think this conversation really points out that there are stories within this data. I mean, recognizing those two pieces of data and how they connect and how they impact each other and inform each other, I think it's just one, aspect of this report. There's so many of those moments in this report where you're like, how is this happening? But this is also happening. And so as we wrap up this conversation, I want to thank all of you for jumping on. Shaniqua, thank you for that last bit. I did put that project, Black Mothers Care Plan, in the chat. Melissa, thank you for sharing your story, Jennifer, and yours as well. Thank you all for being here. I think, the more people that see this report, the more impact we can have, the more impact it can have. And yeah, I encourage you all to go through it and find the stories in it, because there are a lot. Rose, I am so grateful to you for joining us today, for going through this data, going through this report with us, walking us through it, and really highlighting, how far we've come, how far we still need to go, and how, the Commission for Women is planning on pushing the needle for women in Miami-Dade. So thank you for your time. And yeah, we're happy to have you, and happy Equal Pay Day.
Yeah.
Let's close the gap.
And please email me, guys. I'd love to connect with each of you. And again, thank you, Sarah and Lauren, for this platform. It's really incredible.